Today, I have the great pleasure of having Dr. Ralph Moss here on the pod. With my prostate cancer patients, I don't say, listen, eat whatever you want, don't sleep well, but exercise 6 hours a week. And let's see if just the exercise, right? So it's a multidisciplinary approach. And in my mind, multidisciplinarity means the different lifestyle components. So then it's very difficult to tease out, okay, what's the one thing? Maybe, Ralph, maybe we're looking at it the wrong way.
Yes.
Maybe the one thing can be, sure, with the one thing, you can patent it, you can, create a lot of wealth from it, but maybe we're looking at it, we're barking at the wrong tree there.
Undoubtedly, we are.
There's a lot of pathways.
Right. And I spent almost 10 years as an advisor to the NIH on these other kinds of questions that came up repeatedly. And one of the things one path they started to go down was the so-called black box approach, meaning, let's say we want to know how well people do with Dr. Gio's program. But Dr. Gio's program could be 20 different things, including Dr. Gio as part of that small part.
By the way, we're sort of tongue in cheek, right?
Yeah, right.
But most of my patients would say, you're my shrink. Yeah. You're not only my doctor, you're also my shrink. You listen to me.
Well, Gio, I think in a way you helped save my life, because when I was diagnosed with prostate cancer, as you well remember, we were acquainted. Yeah. We weren't yet as close as we are now, but we were acquainted. You had come to the film that was made about my life and my, if you remember, Second Opinion in Greenwich Village. There was a theatrical showing of the film, and that's where we've actually, one of the first times we had a chance to talk. We had been corresponding for years before that. But anyway, when I was given this diagnosis with this famous...
Go ahead and expand on that, actually. So you were diagnosed... Actually, we can segue into that, because that was a good story.
So I was living in Pennsylvania. Yep. And the closest comprehensive cancer center to me was in Philadelphia. It will go unnamed. I just don't want to start up a big fight with them. But anyway, a very famous, very highly ranked urology department at a very highly ranked university. That's all I'll say. So I went in there.
That narrows it down quite a bit.
Yeah, quite a bit. and it wasn't Fox Chase, I'll just say that.
That's right.
So you can make your own assumption. But in any case, so I had it. My PSA was rising. It was 6.6, and my free PSA had fallen, and I wasn't having any particular symptoms, but that was enough for me to insist on having an MRI, and they were willing to do the MRI in advance of doing the biopsy, because I was still trying to, like many men would, try to avoid having the biopsy. And so I went there, and basically the MRI, well, it seemed to show that there were tumors in my prostate. So I went in to the urologist the one they provided. Now, this was the last appointment on Friday. I was able to get in at the last appointment Friday. Not a good time, by the way, to ever see a doctor. Mm-hmm. There's, kind of exhaustion goes on and builds over the course of the week.
That's a very good point. That's an excellent point. Yeah. I usually recommend my patients who, for example, will undergo a prostatectomy. I said, try to be the first case.
That's right.
Try to be the first case.
Exactly.
See your doctor. Don't see your doctor late in the afternoon if you can avoid it.
Absolutely. So this was both Friday and late in the afternoon.
Yeah.
And this guy came in, no eye contact, mumbled his last name by way of introduction, sat down at the computer, started typing, and basically my wife was there, and what he said was, well, you've got 2 large tumors, and they've broken through the capsule, and the disease is now spread, and there's no curative treatment for you.
That's right.
And there's nothing we can do, but we'll continue on. We'll do the biopsy to be able to stage it. And the only thing we could offer would be radiation at this point, but it's palliative, not curative. This is essentially what he said to me.
Right.
Now, I had read the pathologist report, but even though I've had 50 years of reading, scientific reports, when it comes to you, it's a little hard to interpret, right?
That's another fascinating point, by the way. Yeah, that's
hard to read your own death sentence.
Right.
Let's put it that way.
That's right.
So when I said, well, could we see, because I was confused because I didn't think that's what the report was saying. I said, could we see the MRI on the screen to show us where it has exited the capsule, which for I'm sure most of your listeners and viewers know that's pretty much bumps you into a much higher, more difficult stage of treatment, means that the disease is systemic now. And he blew up at me and he said, I'm a urologist. I'm not a pathologist. I'm I'm just telling you what it is. I'm a urologist. So then that night, I thought we were sitting there in the hotel room trying to recover our senses. They had scheduled me for
the trauma,
a biopsy, the trauma, yes, of the next Monday. And I managed to reach you. I had your number in my phone, and I was really in a bad way mentally. I was not prepared for this.
Yeah, I remember that conversation with you for sure.
Right. And I was sitting there and you said, whatever you do, don't do anything precipitously. Because you know how it feels when you get a diagnosis of cancer. It's like, ooh, get this off me, get this out of me. It's like I was pretty well.
Don't just sit there, do something. And sometimes you just have to sit there and do nothing, at least for a period of time.
So you said that, and you were very good. And you said a couple of other things that you said was, look, I'm not. There could be other explanations for this.
Yeah. And
not going to tell you should come to NYU, even though I work there, and but I'm not going to advertise or whatever,
That's right.
You should come to NYU. But what in the course of the conversation, what I said was, well, I wanted somebody to read this MRI again, who's skilled, and maybe do it over, and then we talk about treatment. But I was kind of averse to having surgery or radiation already.
Right, you know too much.
Well, in a way, yeah. I mean, sometimes you have to do it.
Absolutely.
I'm not
by the way,
faulting anybody who does it.
No, not at all.
Yeah.
Yeah, not at all. In terms of, I say that because, when you are in this field, in the field of cancer, and then you're right, like looking at your own stuff is like, wait a minute, I can't even read this. Then when it comes time to choose a treatment, you have a lot of information in your head that may bias you towards or against a certain type of treatment that might be, because you're right. Look, I'm a naturopathic doctor. Less is more for me always.
Yeah.
Lifestyle medicine to me is everything. But there are men who benefit, and if they go to the right surgeon, they do amazing afterwards. So yeah, that's
plus,
indeed
nowadays also you could talk about freedom of choice, but you have to have the money to be able to implement that. And if you're in a health plan that doesn't allow you to get like cryoablation or other less toxic, less damaging types of treatments, you're either going to pay, either not get it, or you're going to pay out of pocket, which could be considerable. Everything's expensive nowadays in medicine. The slightest little thing they do. So I can understand why people would be averse to even, they want to take the best choice they have within what's available to them.
So Ralph, yes, so then we spoke, and I tried to give you some guidance, and I certainly will say, look, at minimum, we need a second opinion. You don't have to come here to NYU, but we need a second opinion. But then you did come, and how was that for you?
Well, that was great. Yeah, and I'm an NYU graduate myself, and it just happened that this was the 50th anniversary of my graduation from my undergraduate degree. I spent instead of going to the reunion, I spent it in the urology department.
Well, listen, it is an NYU affiliated campus, so you were in the right place.
True. Not in the position I thought I'd be in, but anyway, it was all good. I mean. But as I say, I think, everybody should have a friend like you at that moment in their life, to talk. It was simple, but it was very, very instrumental, calm me down. And I was able to now think, well, there's other options. I haven't just fallen into this unfeeling, uncaring type of environment. I mean, I think I don't have enough bad things to say about the way that I was initially treated. It's still, I really had a kind of PTSD, post-traumatic stress
to me
after from the shock of it, and then to be treated in a completely uncaring, unconcerned, and totally erroneous.
And to me,
fashion.
Ralph, it doesn't matter. Look, if it's Friday afternoon and I am not paying attention to you and I'm not looking at you in the eye and I am not being empathetic to your situation, then then fire, you need to move on. You need to fire your doctor in that scenario. And I tell my patients that it's very important for us to develop a relationship. If we cannot do that, please, go ahead and find. I welcome you. I want you to find someone else, and maybe I'm just not the. It's a very important. That relationship is sacred, at least to me and many others. Ralph, here you are. This is Ralph Moss. Decades of cancer research.
Yeah.
Visiting clinics all over the world. And now you're the patient.
Yeah.
What is, I think there's a movie where the doctor becomes the patient, right? I forgot the name of that movie, where the good doctor, but he has an attitude problem and
right.
And then he becomes, and that humbles him.
Yeah.
I don't think you needed to be humbled because you're a humble person or prior to that. But what was your takeaway and what's your thought from becoming a researcher and looking at it as a researcher to, wow, now I'm the patient? What was the big takeaway there for you?
It definitely changed my approach to the people that I was consulting for, doing phone consultations for. I said it's a little bit like Dorothy in The Wizard of Oz, where everything becomes Technicolor. It's like suddenly things that were just black and white, namely things written on the page, you suddenly see the nuances and you see the emotional component to it.
Yeah.
And I would say, I mean, without patting myself on the back, I feel that it made me a more compassionate person, a bit more aware. I certainly stopped doing certain things that I was prone to do for a very long time, making jokes, or categorizing people. And not that I'm totally free of doing those kind of things, but it suddenly it wasn't funny anymore. Not that it ever was funny, but I had a tendency to look on the humorous side of things.
Bring light, a little bit of light in an unfavorable situation.
Correct, but you can overdo that too.
Interesting. By the way, that's huge. I thank you for saying that. I think laughter and humor is also medicinal, but I have to also, I like to do introspection every now and then on how I do things, and there's always ways of improving it. So it's something certainly for perhaps for me to look at. So I appreciate you saying that.
It also, of course, getting involved with you and Dr. Taneja increased my interest in cryoablation, something I had been interested in for a long time. But it brought it into focus, and I still am interested. I'm very interested in the topic of thermal medicine, use of
Sure.
heat and cold, which brings us to another topic, which is my travel, Gulliver's Travels.
Well,
My
before you go
travels
there, a
to,
few things with your case, and
yeah,
I know we're
yeah,
going to go a little bit over, but if
yeah,
you just let me know when you have to go, because
yeah,
I knew this was going to happen, by the way. I
yeah,
said 45
yeah,
minutes, and I was
right,
like, okay, yeah, I know what's going to happen. So
yeah,
I cleaned out my schedule, but you let me know.
yeah,
Diagnosed with prostate cancer, Gleason what?
8,
Gleason 8.
yeah,
Now, when typically in a Gleason 8 situation is really
yeah,
radiation or surgery, I mean, that's
right,
it. Don't look anywhere
correct,
else. You come to see, so Samir Taneja is one of our partners and colleagues at NYU. To me, he, if not the best, one of the best in the business in prostate cancer. So you go to him and you undergo focal cryoablation.
yes, which amazed me because I thought that they would only do it up until Gleason 7. I had
That's right.
2 tumors, 4.4 Gleason, which is consistently, a highly malignant. And if you look in the books, in the textbooks, I mean, under Gleason 8, it says, highly aggressive, incurable, blah, blah, blah. So I wasn't expecting all that much, but I was just happy to have something because the key to the cryo, I think, more than anything, is the word focal. Most people don't understand that.
That's right.
There's cryo where you just destroy the entire gland. That would be equivalent to radiation or surgery. But this is more like the so-called male lumpectomy. In other words, what Gary Onek called the male lumpectomy, meaning take out the tumor and then some area around it and hope for the best. I also, of course, being a married man, was very concerned about issues of sexual potency and urinary continence. The two things that, most men fear about conventional, from my knowledge, my understanding.
Yep.
So I've been very fortunate in that I haven't really suffered side effects of that I know of from the procedure. So I think this is a very important consideration.
And the procedure was done 8 years ago?
Yeah, it was in 2015. So yes, it's coming up. It'll be 8 years this year.
8th anniversary coming. And you're
well, I'm still well. I have no symptoms, but the PSA is still within a normal range, and the free PSA is within the normal range.
Yeah, because PSA, for the listener, PSA after focal cryo, the goal is not 0 because you still have another half a gland still there. So that's going to create PSA. Yes. And you've had subsequent biopsies, Ralph? I can't remember to determine.
I have the normal, yes, because I think I had, it was certainly one follow-up biopsy, possibly 2.
And it showed you're cleared.
No, it was clear. There was no indication of cancer. It wasn't entirely. I mean, I've had chronic prostatitis almost my whole adult life, so I'm not. So there could be some issues still there, but it's basically still. There's no sign of malignancy at this point. On the other hand, he didn't destroy everything that could possibly have been, a malignancy there. This is an issue that I think still needs to be further examined, is what the long-term effects of cryo are. I can just say for me, it's been very successful. I'm not 100% sure that at some point I might not have further treatment, but it hasn't yet reached that point. So I follow it with PSA as he suggested. I can't, because of the insurance plan that I'm in, I can't just go down and order up an MRI at this point, much less a biopsy. And my urologist retired that I had. So I think I'm okay, but it hasn't been an issue for 7 or 8 years. And, it's
All right.
staying
So
within the
offline,
normal.
we haven't spoken about this in
Yeah,
probably
no.
about 8 years.
Yeah.
So you've been under the good care of Tanisha. You and
Right.
I'll get on the phone, and I'll just make
Yeah.
sure that everything is going in the right direction for you.
Sure. But
We'll do that.
anyway, I think people shouldn't think of this as some panacea.
Correct.
It's not. It isn't. But if
Correct.
I still
But
intend
here
to live
you are, Gleason. By the way, we're talking about a Gleason 8, where this is part of the consultation in my practice. It was like Gleason 8. That's it. All they're saying is this. I said, wait a minute, time out.
Yeah.
There's a notion of, and I don't want to get too much into the weeds here, but there's a notion that says, look, Gleason 6, Gleason 8, it's cancer. Treat the cancer.
Right.
It's the fear is that the higher the Gleason score, which doesn't really matter from a cancer perspective, but the notion is, well, maybe because it's such a high stage that there's a sprinkle outside of the gland. That there's a higher likelihood of there it being some, but that's not always the case, and you can treat it focally. And I think with lifestyle interventions, you could treat it systemically. Lovely, Ralph. What a pleasure. We're gonna have this is amazing. Thank you so much.
You're quite welcome.
How can people find you or your work? Is Second Opinion a documentary still around?
Yes, it's around. If you go to the Moss Report in the singular, there's 1,300 articles that I've written, and all my Moss reports on different types of cancer, including prostate cancer, are now uploaded to that site.
Great. And people can sign up and subscribe to the Moss Report.
They can.
Absolutely.
Just go there and take a look.
All things Moss Report to find all of Dr. Moss's 50 years worth of work.
Correct.
Great. Ralph, thanks so much. So appreciate it. And I appreciate you, and we'll be in touch.
Thank you. We'll be in touch. See you soon.
Much love. Take care. Bye-bye.
Bye.
Thanks for tuning in to this week's episode of the Dr. Geo podcast. You can watch all episodes of this podcast and much more by subscribing to my YouTube channel on youtube.com/Geo Espinoza ND. If you love what you heard today, you can help by leaving a 5-star review of the podcast on Apple and Spotify, as each review helps us reach more men who are serious about improving their urological health and how to function better with age. And for the latest research and actionable takeaways in the world of men's health and integrative urology, sign up for my newsletter at drgeo.com. I'll see you next time.